So I'm Dr. Paul Cotter from Addenbrooke's Hospital in Cambridge and of St Luke's Hospital, Kilkenny in Ireland.
Are the current guidelines for cryptogenic stroke adequate?
Yeah, I think the first point is that we have very little guidance on cryptogenic stroke, really on what investigation needs to be done, on how to exclude, in particular how to exclude atrial fibrillation. We found that unexplained stroke or cryptogenic stroke is present in about 50%, in particular in younger people, that no definite cause of stroke is found in about 50%. So we feel there's a real area there of unexplained stroke that needs further research and that needs further investigation.
In which, if I might ask, in which patients would you decide to implant a cardiac monitor such as Reveal XT?
I think all people with unexplained stroke, despite extensive investigation, should be considered for continuous cardiac monitoring with the Reveal XT.
What are the main advantages of continuous AF monitoring compared to intermittent monitoring?
Well, I think the main advantage is it gives the answer reliably, and that's the first thing to say, and the most important point. 24-hour Holter monitor has a sensitivity in these studies of about 30% for identifying AF in people with AF. So I would say that they are insufficient and that they're inaccurate, and that continuous monitoring, will give you the answers to whether the patient has atrial fibrillation or not.
What do you use at your institution in terms of risk stratification and so forth? What is the main, because there are so many out there, so.
Well, from the point of view of a stroke specialist, well, when you're investigating a patient, they've had a stroke. So while we have noted that those with increasing CHADS and CHADS-VAS scores are more likely to have AF, and it may have a role as a predictor for AF, once AF is detected, they will all merit anticoagulation. So it is interesting, and there's some evidence now finding that CHADS and CHADS-VAS may go beyond the embolic risk associated with AF, may detect people who have AF, and that's interesting, but we as yet are not using it as a screening tool, and I think that it's an area for further investigation.
What are your perspectives on device therapy for AF management in the future?
I do think that with larger registries, we may be able to predict those more likely to have atrial fibrillation, and it may be that people with certain markers which predict AF would be more likely to have an implantable device like a Reveal XT, but certainly I do see an important role for implantable devices in seeking AF in unexplained stroke.